a number one thing that our participants talk about very quickly into the pain management program is they say, "Oh, I'm not alone. I'm not alone." They feel alone. They feel like a freak. They feel dismissed by the medical system. And suddenly they're in a group of people, virtually or face to face, with different pain, but similar circumstances. And they come out of there, that first session, they go, "I'm not alone." And that is hugely empowering. And by the way, that doesn't fit just for chronic pain. That fits for all different kinds of chronic illnesses and chronic stressors in our lives.
Welcome to Mind My Age, presented by Total Life. I'm your host, Neelam Brar. Today we have an extraordinary guest and a critical topic to discuss: chronic pain management and mental health. In this episode, we will explore the intricate relationship between chronic pain and mental health and how innovative psychological approaches can help manage chronic pain effectively. Joining us today is Dr. Beverly E. Thorn, a renowned psychologist, researcher, and author. Dr. Thorn has extensive expertise in chronic pain management and cognitive behavioral therapy. She holds a significant position at the University of Alabama and has made remarkable contributions to this field through her research and publication. You've conducted notable research on cognitive behavioral therapy for chronic pain. What are some tools or resources or tips that you can share with our listeners who are navigating chronic pain?
One of the things that I studied a lot in mid-career is something called pain catastrophizing. And that is really awfulizing about pain. And I know about it because I have had a history of migraine headaches. And so one of the things that I would do when I got a migraine aura is I would go, "Oh my gosh, I can't afford to have this aura now. I can't afford to be in the hospital now. I can't afford to go to the emergency room. I've got way too much." Guess what happens when I awfulize like that? My pain level goes up and my migraine gets worse. Rather than if I learn to say, and I have learned to say, and I've taught patients how to say, "This is a sign that my body needs to do some resting right now. And I'm going to take care of myself by doing some resting." That is a hugely different way of approaching it in our head, our self-talk. One of the things that I really expanded upon in my research and in my therapy is helping people, first of all, be aware of their self-talk because it's on under the surface often. And second of all, be realistic in their self-talk.
In addition to mapping the thoughts, feelings, and emotions, what strategies can our listeners use to manage the chronic pain through cognitive behavioral therapy and other psychological approaches?
One of the things that I was talking about is the cognitive part, but cognitive behavioral therapy involves a whole lot more than that. We do a bunch of relaxation strategies. We give people a smorgasbord of relaxation strategies that they can use to calm their bodies and calm their minds down so that they can step back a little bit emotionally and see what's going on. So we do relaxation. We also teach meditation, and meditation is a little bit different from relaxation. Most people get relaxed when they meditate, but meditation is teaching people to focus on their breathing. And when they have thoughts that come through as they're meditating, to just observe the thought without judgment and then allow the thought to pass rather than grabbing onto that thought and going, "Oh my gosh, it's going to be terrible." So we teach meditation. We also teach people to pay attention to their physical activity. When we have pain, we tend to withdraw physically and we go, "Oh, it's too bad. I can't do that." We have fear of pain. And when we become immobile, we actually get worse rather than better. So those are a few of the strategies.
What's interesting in your work is that you mentioned 3 out of 10 people have chronic pain, and most people with chronic pain have pain in more than one part of their body. Everyone's pain is different, but people share also a lot in common. How can connecting with folks in the community or peers help people manage their chronic pain and improve their suffering or reduce their suffering?
The a number one thing that our participants talk about very quickly into the pain management program is they say, "Oh, I'm not alone. I'm not alone." They feel alone. They feel like a freak. They feel dismissed by the medical system. And suddenly they're in a group of people, virtually or face to face, with different pain, but similar circumstances. And they come out of there, that first session, they go, "I'm not alone." And that is hugely empowering. And by the way, that doesn't fit just for chronic pain, that fits for all different kinds of chronic illnesses and chronic stressors in our lives. Um, so I'm not alone. That is a really important piece of that.
You mentioned a lot about breathing and the correlation with breathing and stress and breathing and pain. What are some breath techniques that can support relaxation?
So there's a lot of different breath techniques, but one of the techniques that I teach is called belly breathing. And basically, most of us breathe from the top two-thirds of our lungs. And interestingly, we don't do, especially when we're anxious, we may breathe from the top third of our lungs. Everybody's heard of hyperventilation. One of the reasons hyperventilation occurs when we're very stressed and anxious is we're breathing from the very tip top of our lungs and we're not getting enough oxygen into our body and into our blood. Belly breathing is a technique to get people to pay attention to drawing the breath deep into their lungs. And when you do that, your belly actually expands a little bit, like a balloon. And then when you exhale, your belly actually retracts a little bit, like a deflated belly. So they get the idea I usually have them put one hand on their chest and one hand on their belly. And as they inhale, to make sure that their belly is expanding, and then make sure as they release their breath, their belly goes back down. And we actually have them slow their breathing down too and pay attention to the process of breathing.
Chronic pain can really make you angry, frustrated, sad, depressed. And that often impacts how you feel about yourself, but also how you might be communicating with others. One of the facts in your pain research you share is that there are 3 ways of talking to others: the attack way, the retreat way, or the stand tall way. Can you elaborate for our listeners what that means?
Sure. And I mentioned the stand tall technique, but I didn't mention the attack or the retreat. And it's very useful one. Retreat is when we don't ask for what we need and we are a doormat and we don't feel like we deserve to ask for what we need. And so we shut up, except then our gunny sack gets full of rocks and we explode and we do the attack talk thing. And then it's, "You never listen to me. You never do this. Why do you ask me to go to the movies? You know that I can't go to the movies. I can't sit there. Why do you even ask?" And what we're doing, of course, when we do that is we're driving people away. What we do when we have the retreat talk is we're guaranteeing that we're not going to get our needs met. So the stand tall, once again, is asking for what you need without apology in simple ways. And sometimes saying, "This will really help our relationship or it'll help me get up and do more." And that's the whole goal. So what we try to do is get people to pay attention to attack talk when they have it and retreat behaviors when they have it and move more towards assertiveness or stand tall talk. And once again, that's useful for all of us, whether we have chronic pain or not.
I encourage everyone to check out Dr. Thorn's research and resources to implement these strategies. Her website is drbeverlythorn.com, and you can download her free patient-friendly workbooks. Join us next time for another insightful discussion on Mind My Age. Thank you, Dr. Thorn, for joining us today, and thank you to all of our listeners for tuning in. You can connect with Total Life at totallife.com and with me on social media. Don't forget to subscribe, rate, and review the podcast on your preferred platform. Stay mindful, stay healthy, and keep thriving. Until next time, this is Neelam Brar signing off.